So they're the words there. The system catastrophically failed to live up to expectations. Was that entirely unexpected for you?
No. We've had a series of commissions, inquiries, reports over the last 25 years. Each has arrived at the same conclusion. What's different here, I think, is the Victorian government concession that that's the reality, and we need fundamental root and branch reform.
And what should that take, in your view? I note that the Premier has committed to all of those recommendations, which is a good start.
It is, and Victoria is trying to set up a new system, a new structure, really regionally based, largely outside of hospitals, to provide that type of community support that we've talked about for 30 years. He's saying we'll go ahead and do it. I've got to say, he also said, though, it will cost a lot of money and it will require absolutely federal government cooperation if it's to happen in Victoria, and certainly if it's to happen anywhere else in Australia.
Yeah, and are they likely to get that, given what's going on with aged care? There was its Royal Commission findings handed down just a couple of days ago. That requires a whole lot of help, essentially the system being rebuilt from scratch as well.
So the Morrison government faces two really big issues: aged care, which is primarily the responsibility of the federal government, and mental health, which is a shared responsibility between states and federal government. So what COVID has revealed is two of the most important parts of the health system, mental health and aged care, which were left to fall apart, could not cope with the COVID-related stresses, and they've been revealed to be fundamentally dysfunctional. So they are two big reform tasks. They're costly, but unless they get it structurally right, unless there's serious agreement, the danger is pouring a lot of good money into bad systems. So what's happened in the past is a lot of band-aids, a lot of small programs without the fundamental reform. So this time around, it's for both levels of government, and I must say for every other Premier, to front up and say, you know what, it's broken in New South Wales, it's broken in Queensland, but we really need the fundamentals to come together. Federal support, but state delivery.
Sorry to interrupt there, Ian. Just on that point there, and that's what the report found, and I'm quoting here, that people continue to have human rights breached through compulsory treatment, seclusion and restraint.
Yeah, so what's happened is when the system falls apart and people are very unwell, the system becomes more custodial than actually caring. And what's happened is a deterioration. So we now see more security guards in mental health facilities in emergency departments, often the nurses or doctors. So we fall back on a very custodial approach, and that involved physical restraint, it's involved chemical restraint, use of medicines, where more caring environments would have happened. Exactly what has happened in aged care. So the same problems have been known for a generation, but not fixed.
Well, and just on mental health, because there are so many different parts of it, Ian. And a lot of it we're still just coming to terms with. We're still just working out. So how do you plan for that moving forward when there's so much of it you don't know?
Well, it's been a neglected area. So we do know a lot, but we know we haven't focused in a lot of the right areas. Another really good aspect of the Victorian report is an emphasis on young people, not treating the people the same at all ages. So children in schools, in partnerships with education, and they're very much early intervention in the teenage and young adult years. So kids will go back to school, people go on to work and productive lives. So Dan Andrews made a key point. Spending money there saves money in the long run. And so mental health, a bit different to aged care, there are big productivity gains, big investments for the nation if we get it right.
Yeah, and just on that point of how to fund it, Ian, I mean, so much talk about whether there's going to have to be an extra levy to pay for aged care. What's being talked about here? Is the taxpayer going to have to stump up more for this one?
Well, that is the big question. So the Victorian government originally said that they would introduce a new tax levy on Victorians just for mental health. I don't personally think that's the way to go. Individual levies for Medicare, etc., don't pay the real costs. It's an issue of national priorities, long neglected. I think the mental health one has a strong economic case as well as the human care case. If you invest in youth mental health, young people getting problems right before they're severe, you will make money in the long term. But it does require big funding, so this is a priority question for the Morrison government alongside the state governments.
The Victorian government announcing plans to extend its state of emergency for the rest of this year is hardly going to help, is it, Ian?
Well, the COVID situation has obviously created an economic crisis for the nation as well. But if you look at the modelling I've been associated with, it creates a mental health crisis. And that plays out particularly for young people and particularly those in casual work. So we face a number of complex issues. The governments have a commitment this year, and it's good to see the Morrison government committed to this as well, how to do it. And I think the thing is, got to get the structures right Just pouring money into bad systems is a waste of money, but pouring money into smarter systems, early intervention, continuing care outside of hospitals is better care, but also more economically efficient.
But how is it going to help? If the Victorian government is extending the state of emergency powers, which means they can basically lock down whenever there is a little outbreak, even a little outbreak, for the rest of this year, how is that going to help people, in particular businesses, and their mental outlook, their mental mindset?
So there's no doubt that the lockdown effects have an adverse impact on mental health, and really across the states and territories we have no consistency. We've seen situations similar in Queensland and at times in WA of closing state borders, stopping travel, interfering with people's lives. So I think that's one of the other issues that the National Cabinet hasn't really sorted out. You know, there's a lot of hope at the start that a National Cabinet would take national decisions. And I think you're raising the challenges that we face when each Premier goes in their own direction, when you need a national approach to solve these problems.
OK. Professor Ian Hickie, appreciate your time this morning. Thanks for joining us. We'll talk to you soon.
Thank you so much.